people need to be mindful that, insulin resistance is caused by two mechanisms, not just one, not just by carbs, like these really like sugary, highly refined and processed carbs that cause lots of insulin production and insulin surges, but it's also caused in combination with.
Okay, keto campers, I am super excited to bring on an amazing human being. Not only is she an incredible health practitioner who has such great experience in the space of fasting and keto and health in general, but I consider her a friend, a colleague, and she has been on the Keto Kamp podcast once before, and now she's back. Megan Ramos was on the Keto Kamp podcast, episode 103, where we talked about intermittent fasting strategies, which we'll get into today as well, how to break a weight loss plateau, should women fast differently than men, and so much more. We also get into her story on that episode, so you can listen to that on the Keto Kamp podcast, episode 103. Today, we're going to get into, first, how do you even start fasting? How do you stop snacking? And then why it's important to change your fasting schedule. We're also going to get into common health complaints and side effects and what we can do about that. And we're going to get into her brand new book. So without further ado, let's bring on the incredible woman of the hour, Megan Ramos. Hey, Megan.
Thanks, Ben. That's quite the introduction.
It's well-deserved. I'm happy to be here with you today.
Yeah. Me too. Thank you. I'm always happy to chat with you.
We always have a good time. I see there's many Keto Kamp Academy members watching here. And hey, feel free to post your questions in the chat box. We're going to do some Q&A towards the end here. But I want to start with this, Megan. For somebody who's just brand new to this space of low carb, high fat, keto, and fasting, and they want to practice fasting, but they're having issues with just wrapping their mind around how can they go 2 hours, 3 hours, 5 hours without snacking in between meals. How do we stop snacking?
So snacking is something that I think for anyone who's also part of the fasting method community or has been following me lately, is sort of the thing that's driving me most mad. It's what I see in stopping people from making progress. But cutting out snacking, I think, is just like fundamentally the best thing you can do. Whatever diet you're following, keto, carnivore, low carb, paleo, whatever diet it is. And even when you're fasting, it's so important to cut out snacking. So if you're brand new, if the idea of doing something like a 12, 14, 16-hour fast seems impossible, and even just going from like lunch to dinner seems impossible, it's good to focus on just eating real whole foods at your meal, getting in plenty of fats, reducing your sugar and carb load at that meal. But in between, just relying on some fluids, some water to help get you through, having some bone broth or a low carb based vegetable broth. If you're really struggling and desiring for a certain taste, having some herbal tea, if that's a beverage that you do consume, and just utilizing these fluids. Mint, for example, has been widely used to help suppress appetite. So even adding in some fresh organic mint leaves from your own garden, that can make a really big difference and help you get through those few hours. And I think when people are new to fasting, being able to make it from lunch to dinner, that's a big accomplishment. And we build upon small successes. We reach our big end goals by having a series of small successes along the way that help us build confidence. So not snacking is the number one place to start. So if you're new to fasting, and you're thinking, oh my gosh, this is overwhelming. Look at all those hours on the clock. Time's moving super slow right now. Just focus on going back to the basics and eating those 3 meals a day and just getting from meal to meal. And you'll build up confidence utilizing the fluids to help get you through. And once you build up those confidence, you'll slowly be able to cut out the meals and make more further small successes. But the number one thing that I see people cause them to regress, plateau, hit walls, all that kind of jazz is snacking on their eating days. So they wake up, They have their coffee, their tea, their water, whatever it is that they're choosing to have in the morning time. And then like the clock strikes noon and it's game on for like 7 hours of eating. And people need to be mindful that, insulin resistance is caused by two mechanisms, not just one. Not just by carbs, like these really like sugary, highly refined and processed carbs that cause lots of insulin production and insulin surges, but it's also caused in combination with the chronic secretion of insulin. And when someone already has insulin resistance, their system's full. You're full of insulin, you're just jam-packed, your cells are resistant, and even adding in a little bit of insulin. So people will say, but it's macadamia nuts, it's hard cheeses, it's a little bit of unprocessed meat, it's grass-fed beef. It doesn't matter. Your body's still going to produce some insulin, and you're already in a severely insulin resistant state. So you need to cut out snacking and get back to the basics and go to meals. So even for beginners, or even for the majority of advanced fasters I see out there, we can get great success by cutting out snacking. And I just truly believe, like, if we just eliminated snacking, eat those nuts with your meal, eat that cheese with your meal, if you eat dairy, like, do what you do, but do it at your meals and don't snack in between. It's a great place to get started, and it's a great place to help troubleshoot and to help you reach your goals if you're already into your journey so far.
Well said. That's for anybody, whether you're advanced or not. The snacking is a killer. The pancreas is not designed to stimulate insulin throughout the day. Insulin is the only fat storage hormone in the body. And even if it's the healthiest keto snack, organic, free range, whatever it is, it's still going to give you that insulin spike. So you go from being in a lean, fasted state to now storing fat, and you're burning out those beta cells. And then overall, like you said, it leads to an issue. I love what you shared, Megan, about it's these small little changes that kind of compound over time, kind of like the compound effect. I always say that small tweaks lead to giant peaks, right? So just making this small decision here to have your snacks, you could still have them, but have them with your meals, and just have your 3 square meals to start. That really puts you ahead of the curve here when you're ready to fast, because then you're building up this muscle, and then you could start with the fasting. Do you know if there's any research out there? I've read some research from Professor Brian Peskin, who is an MIT researcher. And in his book, he said the pancreas is designed to produce insulin only about twice a day max. Do you know if there's any research around that? Does Dr. Fung have research there?
Yeah, I think we've got some blog posts actually up on the subject, but we're really not designed, our pancreas is not designed to function to support us eating more than a couple of times a day. So we're absolutely burning out that pancreatic function when we're eating constantly throughout the day. And I've seen you post a lot about this too lately, because when you asked about what I want to talk about, it's like, Ben, I share your passion. Like, eating all day long is just making us age faster, it's making us sicker, it's hurting our metabolic and cellular health. We're just not designed to eat more than a couple times a day.
Yeah, well said. And we'll find those articles and we'll put it in the notes. Rachel, our podcast notes person, will put it there. Okay, awesome. So now they have cut out the snacking, Megan, and they're having their breakfast, their lunch, their dinner. Now they want to start fasting. What's the best way to adopt a fasting schedule?
I think most people feel comfortable cutting out breakfast as a first go-to and entering sort of what we see being called the 16-8 sort of diet. But I don't like that. But I like the 16-hour fast, but I don't like the 8-hour part, because we don't want to be eating for 8 hours. We just want to be having lunch and having dinner in that 8-hour window. But most people will cut out breakfast. And this works great if you're a type 2 diabetic, for example, because you'll see the dawn phenomenon in the morning. So before we wake up, we get production of some counter-regulatory hormones. We see our blood glucose levels go up. In diabetics, it's a sort of a substantial increase. We call it the dawn effect or the dawn phenomenon, where these blood sugar levels just start to surge. So it's good if you skip breakfast and get up and get moving, bring those blood glucose levels down, and then 16 hours, into your fast, after being awake for a few hours, seeing the glucose come down, then introduce that first meal. The only time I would recommend that someone does keep breakfast and try to eliminate dinner instead is if they're really seeing high reverse T3 on their thyroid test. I found that having breakfast, really sort of blunting that cortisol effect in the morning time, we can see a dramatic reduction in reverse T3 levels. So we get more weight loss when we do eat breakfast in those particular individuals. But for most, the diabetics, traditional metabolic syndrome, most people cut out breakfast and they'll do the 16-hour fast with just having lunch and dinner. And people should try to do that every day, because to build up that fasting muscle, you know, if you only go to the gym once a week or, you know, once every few weeks, your muscles aren't going to get that stronger. It's the same with fasting. So because 16 hours is a mild fast, it's like stretching every day. And so you show up every day, do that stretch, you know, to get your fasting muscle in the groove. And then once that becomes easy, then cutting out lunch, cutting out dinner, depending on what works best for your schedule. Ideally, you know, we encourage people to try to eat earlier in the day. If they are going to eat, we found it really impacts things like heart rate variability and sleep quality if they're eating too late into the evening time. But some people prefer to have dinner, not to disrupt the family environment too much, or they find it more difficult. So you would either cut out lunch or dinner and do a 24-hour fast. Sometimes I would really push lunch versus dinner as the meal on the fasting day or for the breakfast meal, is if someone is sort of really struggling with that 4 to 6 o'clock window. Like we always, a lot of people always refer to that as their witching period. Like if they can get from 4 to 6 o'clock without eating, and we know that there's changes in adrenal hormones, there's lots of adrenal fatigue out there, and it's a tough time because if you're not able to produce sufficient quantities of cortisol, it can be tough to get through that little bit of a window. So sometimes we'll encourage people to really try to eat lunch, but otherwise we'll try to experiment with electrolytes such as sodium to really give the body support to make getting to that dinner hour more pain-free for the individual. So people would go to a 16-hour fast with 2 meals and then to a 24-hour fast with 1 meal. And we would do, if someone was doing a 24-hour fast, we would do that about 3 times a week to really try to combat metabolic syndrome. And then from there, we just assess results. Are you feeling good? Are you seeing your fat loss? If that's the goal, are you seeing improvement in your blood glucose response, reduction in inflammation? And then we would assess if perhaps an individual needed to do a complete day fast where they skip breakfast, lunch, and dinner, or if they maybe needed to do an extended fast, just if insulin resistance was very high, if they're struggling to come off of insulin, to, you know, really help bring down their insulin resistance and get them off of these toxic medications.
Well said. Yeah, those are a lot of nuggets in that. It was a very jam-packed answer. So I recommend actually going back and rewinding that and listening to what you shared there. No, it was awesome. I have come to find that eating more protein during the eating window, along with the fat, like you said, really helps. It activates these cholecystokinin and these hormones and chemicals that help satiate you and prevent you from snacking in between the meals. And the salt also, a lot of people, they're getting their signals crossed, which is they're not really hungry. It's the sodium and it's the electrolytes that are low, and the signals get crossed and they think they're hungry. I would also love for you to touch upon hunger, the hormone ghrelin, and why it's important to understand that all hormones spike. And as long as we just give us some tips on when we experience that ghrelin hormone.
Yeah, so hunger cycles throughout the day. All of our hormones go up and down throughout the day. So for people who check their blood pressure all day long, you know, they'll come in and they'll say, well, why is it higher at noon when it wasn't that high in the morning? And then it goes down in the evening. And none of that makes sense. Or the same thing with blood glucose levels or things like hunger. All of our hormones follow a circadian rhythm. So they go up and down throughout the day, causing these different responses in us. So we do see ghrelin cycle throughout the day, and we do see these waves of hunger that come. So often when you do hit a hunger wave due to ghrelin fluctuations, it's best to distract yourself. You could try having some natural appetite suppressants like peppermint tea, for example. Some people find that apple cider vinegar and water, just a shot of that, is a really great appetite suppressant. Having a little bit of salt can also help suppress the appetite, but just keeping busy. And most people find that once they get busy for 30, 60 minutes, the hunger wave has started to subside. So hormones fluctuate throughout the day, and due to that, you experience all different types of fluctuations throughout the day in different functions, and one of them is hunger. So people say, "Oh, am I just broken? What's wrong with me?" It's normal. So just ride out the hunger wave. Get busy. A lot of people actually create some lists of things to do that they can to distract themselves, or stress reduction. I think in today's day, it's just we were talking earlier, like what a freaking bizarre year we're in, and there's all kinds of politics and stuff, and I think people are just trying to do their best by what's going on around them and sort it out. But stress, and then I know parents are navigating like a whole different type of sea of stress right now that I'm fortunate I don't have to deal with. So using this time when hunger strikes, all right, this is where I go and I do that 12-minute meditation. This is where I go do those, deep breathing exercises, do some red light therapy, like take some time, for yourself, do red light therapy, listen to Ben, and his great words, some wisdom,
Thank you.
and ride out that hunger wave and just distract yourself. So I'm trying to use it as a positive thing. I'm trying to encourage other people. Okay, when you get this hunger wave, try to look at it in a different perspective. Okay, this is now my time to go do some self-care to help control my cortisol, my stress throughout the day, and get distracted doing something else. And not only are you riding up the hunger wave, you're doing something that's also going to help control your hunger later on by controlling your cortisol levels as well.
So you had mentioned glucose fluctuating along with the blood pressure because our hormones are pulsatile, they're up and down. Mm-hmm. So that's important, because I get so many of the members of the Keto Kamp Academy who are watching right now saying, why is my glucose at this level, but I didn't eat anything, and then yesterday was at this level. So that's why it's important to get an average, maybe a 3 or 4 day average. Mm-hmm. There are so many factors besides the fact that, yes, your hormones fluctuate. It could be your sleep wasn't optimal last night. We know that when your sleep is poor, you'll have higher levels of cortisol and glucose will follow. So my question is this: have you ever used, or have you ever had your patients, clients use a continuous glucose monitor?
Yeah, I wear a Dexcom G6 myself. My insurance covers it, so I wear it, and it's really wild to sort of just see the fluctuations, or see. I got really grumpy with my husband recently. I wasn't feeling well that day. I was, but like just seeing how my blood sugar went up, or I was telling Ben I had a bit of an unfortunate incident over the weekend. And so I literally did nothing but try to drink water for like 48 hours straight. Water, salt, magnesium, that was it. And my blood glucose levels nearly tripled because my body was experiencing some stress and some inflammation at that time. So it's really just crazy to see your body's results. Or how it handles these certain situations, or just the general day-to-day hormonal fluctuations. We actually have a whole bunch of people wearing like the Freestyle Libra right now in the community.
Yeah, I'm using that now. I have one now too. Yeah,
it's pretty wild just to see like how your blood sugar changes throughout the night, even due to the hormones, and throughout the fast too, because when you're fasting, you get this production of these counter-regulatory hormones, and you'll see glucose levels start to fluctuate. It's particularly, if you're exercising in a ketogenic state and producing even more counter-regulatory hormones, you'll get more cortisol production. You'll see the glucose levels go up. So it's really neat to see, and I think that wearing continuous glucose monitors is just an incredible tool, and I think it really can help shape behavior change. Definitely helps people snacking, prevents people from eating carbs naked. Not that like you can be naked while you eat the carbs, but you don't want to eat like the sweet potato or the berries when you're carb cycling, like just on their own. You want to dress them up with some fat and fiber and protein, right? So wearing these CGMs, I mean, it can shape, your behaviors, your stress responses, that really guide you towards, breathing and chilling out, going for walks, prioritizing your own health. But it can and help you manage your foods, but it can really help give you insight and just to these regular rhythms of your body. And if your body's rhythms are just really thrown off and your circadian rhythms out of whack and you're not quite sure what's going on, wearing this CGM can help her maybe provide you with some insight into that. And then you can be proactive and start doing things like going outside in the middle of the day, getting direct sunlight, getting sunlight first thing in the morning, and just working on fixing your circadian rhythm issues, getting your hormonal levels in a better sync. So CGMs provide so much wonderful insight, I think.
I do too. They're awesome. I have one as well. For the first time I'm using it, about 10 days in, and it's really fascinating data to see what exercise does to my glucose, to see what specific food. It's a great way to determine if you have a sensitivity to a food. Last night, I don't know what I ate, but I tested. I'm testing throughout the whole day, like 30 times. It's so easy. I just put my phone here. I have it right here. And my glucose went up to 145 last night. And I didn't really have that many. I had some fruit, some berries, some pecan butter. So I want to now find out what I ate last night and single it out and see which one of those foods am I not have a sensitivity to. So it might be the blackberries, I suspect, but it's cool data to see what's going on. And you could see if you're hitting those optimal ranges, right? You want to be in that 70 to 90 in American units fasting glucose. It's not telling you your ketones, but you can see how gracefully you're aging, how well your pancreas is at producing insulin to bring the glucose back down. So it's fantastic data. Catherine, who's a member here in the Keto Kamp Academy, wants to know, how can she get her insurance to cover a continuous glucose monitor?
So I am based in Canada. Mind you, most of the people I work with are American. So from engaging with them, a lot of them just call their insurance companies and let them know that they're experiencing certain issues with blood glucose, reactive hypoglycemia, really high dawn effect on phenomenon. They're looking for an intervention aside from medication that's more economical. And a lot of them have ended up getting the Libra or the Dexcom covered. Now, in Canada, it's entirely different ballgame when it comes to the prices for these things. We're about, I think about a quarter of the cost of what they are in the United States. So it's more difficult. And here, all of our insurance companies have coverage for Libras and Dexcoms. So it's more difficult in the United States. So I would just try to work with your healthcare with your healthcare provider as well too, and see if you can negotiate it. The reason for mine was preventative medicine, and my insurance company approved that because I don't want to be an insulin case. So I want to learn what diet works best for me and what lifestyle works best for me so I don't become diabetic. And they approved it on the phone. So I think having these conversations are great. Ben, you're in the United States, so it might be better.
Yeah. That's great advice right there. I'm going to be interviewing a medical doctor from a company called Levels, who they're the ones who sent this to me. So Catherine and anybody else watching from the Academy, if you're in the US and you want to learn more, I'm going to ask her these questions. I'm going to interview her in a couple of weeks, but I do think it's important to see if you could have your insurance cover it. I would pay out of pocket personally, but they've taken care of it for me just because they wanted me to test it out. But we'll dive a little bit deeper into that during that interview. I want to transition, Megan, into why is it important to change up the routine, change up your fasting schedule? Let's say they figure out I do well with an 18-6 schedule and they stay with it. And then all of a sudden they plateau. Why do we want to always change up? Do we want to always change up our fasting schedule?
In certain cases, like for individuals that are doing like a day of fasting, day of eating, day of fasting, day of eating, day of fasting, 2 days of eating over the weekend, day of fasting, and that usually provides a lot of variation. But when I find people are just having sort of one meal a day, or they're doing sort of the 16-hour fast every day, our bodies adapt to that. I struggle a lot with people who do OMAD, and I think for maintenance, OMAD's great. I think if you're just looking to shake like 20 pounds and there are no other hormonal issues, rock the OMAD. I pretty much do OMAD myself with 2 meals a day on the weekend. But like I'm, for the most part, really like, kind of happy where I am with most parts of my body. Some parts of my body I'm still debating whether they work or not. But most parts,
I like what you said though. Rock the OMAD. That would be a cool T-shirt, like a fat
I guess it's a good thing, but when you're looking to lose weight, and it's the body adapts to it, and so there's a big difference between fasting and calorie restriction. And with fasting, the biggest thing about it is the protection of counter-regulatory hormones, because the body is being induced into this fasting state. But I think having the days be varied and be different is important, so the body just doesn't adapt. So what we see, like with someone who's doing calorie restriction, and unfortunately, I think a lot of people can relate to this analogy that I'm about to use because of COVID right now. But imagine you had to be mindful of your spending, and you needed to reduce your spending by 30% across the board because you're not quite sure about your investments, you're hoping to retire, so maybe you need to be more conservative with your spending right now because you're not sure what your portfolio is going to look like in 2022. So you reduce your spending by 30%. So you might, get rid of one car if you've got two. You might look for foods that are on sale versus just saying, oh, I feel like steak tonight, and buying steak. Well, instead of just buying steak when it's on sale. And that's what you make these changes to your diet and to your lifestyle. And at first, like when you start trying to scale back, you're still overspending. And I think a lot of people have been in this position. I've been a student for like a billion years. So like I've been in this position myself in the past. You get into a little bit of debt when it's like, oh, it's back to school time, I'm not earning money. The visa goes up a little, but then like by November in the school year, you're like, okay, I'm used to student life, I don't got time to spend money anymore. And you're able to pay off that debt. So when you're doing calorie restriction, at first, like your body, if you think of calories as spending dollars for the body, at first you reduce by like 30%, and your body's still figuring out how to function on 30% less salary. But over time, it does. It cuts expenses from reproduction. It cuts expenses from respiratory function, from cognitive function, from all areas. And the body acclimates, and it stays there. And it's like, okay, this is the new energy intake for the day. This is what we're doing every day, and no changes happen, and you sort of hit a wall. So people who do calorie restriction diets, they lose weight at first, but then they stop, and then they start to feel like garbage because their body is running at a reduced capacity. Now with alternate daily fasting, you're in a fasted state. So you burn through glycogen stores, you activate your sympathetic nervous system, you get production of counter-regulatory hormones, you get noradrenaline that helps you burn body fat, maintain your resting metabolic rate by, accessing all that food energy from your fat stores and liberating it, so your body can function throughout the day. Cortisol for gluconeogenesis, you get human growth hormone production. So you get these counter-regulatory hormones that work because it's a shock to the system. Like you're going very dramatic change from what your day was the day before in terms of eating. So you get this activation of the sympathetic nervous system, these counter-regulatory hormones, and then noradrenaline, which really helps preserve your resting metabolic rate. So, at first, when you start doing these diets, you are getting the activation. It is a change. You are burning through a lot of glycogen stores, but over time, it starts to become the same. It starts to become repetitive. The body starts to adapt. systems start to slow down. And we see a lot of people who have significant weight loss to lose that start doing OMAD, think, hey, this is great. I get used to it. I'm only hungry once a day now anyways. But they're just taking in one meal worth of food. We do find that they start to slow down, that they stop losing weight, that they start gaining weight even. So it's like their body's just totally acclimating and it is slowing down. We're not getting that activation of the sympathetic nervous system like we would if people were doing alternate daily fasting. So we do think, unless you're doing true alternate daily fasting, if you're doing these other types of fasts, that it is good to change up to avoid running into any of these issues. I'm not sure if you guys see this in your community. We see it a lot in ours. For people who like to do OMAD, we offer a solution that I think keeps things interesting and as a way to vary it up, where instead of eating, you're still eating one meal a day, but you're altering what meal that is that you're having. So we do something called the 30-16 fast, where people will have lunch on Monday, dinner Tuesday, lunch on Wednesday, dinner Thursday, lunch Friday, dinner Saturday, and then Sunday could be like a real mix it up day or a fast day, however you want it to be. And going from Monday lunch to Tuesday dinner is roughly 30 hours, and Tuesday dinner to Wednesday lunch is 16. So that's a great way to do that one meal a day, do it safely, but still keep variation in your fast, keep the body confused, get the sympathetic nervous system activated, get these counter-regulatory hormones produced that do a lot of the magic and get results. And I found that to be a really good strategy for people who don't necessarily want to do a whole lot of fasting, but like some sort of consistency to their routine and like being in that sort of OMAD space because it works for their lifestyle. It's just to vary that meal up.
Well said. I love how you broke down that analogy with saving cost. And it's so true. That's the biggest difference, by the way, between cutting calories with fasting versus cutting calories with small portion control meals throughout the day. The biggest difference is those counter-regulatory hormones. These hormones, they run counter to insulin. It's actually your body's way, which is that amazing innate intelligence within us, your body's way of pumping you full of energy so you could go hunt and kill and do what you need to do because we're hardwired that way. But we're blessed to not have to do that. So your body is going to maintain its metabolism and might even increase its metabolism. It's not going to shut down. Versus if you had these small portion control meals throughout the day, you're cutting calories, but you're not getting that benefit of the counter-regulatory hormones. So that is a big difference. And for those of you who are confused about the OMAD, most of you know what OMAD is, but there was a few in the chat. OMAD is one meal a day. Kim helped us out there, meaning you just have one meal and you eat until full. You have plenty of fat, plenty of protein. And I love that approach you just explained, the 30-16 hour fast. That is super cool. I think that's a great strategy to add to the toolbox. So well done, Megan.
Okay.
So let's talk a little bit. Let's transition now to your book some more. You have a chapter. I'm going to just open it up here. And then we're going to get to your questions. So Keto Campers, you can keep posting them. You have chapter 18 here in the book. If you're watching on YouTube, I have the book here in front of me. If you're listening on the podcast, I'm holding the book, which is called Life in the Fasting Lane, Dr. Jason Fung, Eve Mayer, and of course, Megan Ramos, How to Make Intermittent Fasting a Lifestyle and Reap the Benefits of Weight Loss and Better Health. This is your latest book, and it just came out in last April, I believe.
Yeah, it's been wild. It came out at the start of all of this COVID stuff here in North America. I actually finally just saw it in a bookstore for the first time.
I saw your photo. Congrats. Yeah. That must have felt so good to see it finally go into a bookstore and see that.
It was cool. They like made me get dressed in biohazard gear before going in there, but at least I got to see it.
Wow. What a world we live in, huh, Megan?
Yeah, it's wild.
Okay, let's talk about bad breath or a bad taste in your mouth during a fast.
Yeah, so this is really common. People think that something's wrong, or you'll get this white film on your tongue too, and everybody suddenly thinks that they might have thrush out of nowhere. A candida infection in your mouth. But when it's sort of accompanied with like the dry mouth and this like metallic taste in the mouth, our bodies, so when we're fasting, we access our fat stores, we fuel on free fatty acids, and we fuel on ketones, and one of the ketone bodies is acetone. So we don't really do much with it, but breathe out the acetone. It's not a ketone body that we utilize. So we breathe it out, and it dehydrates the mouth. It leaves us feeling dry and pasty. It gives us this little bit of a white tinge on our tongue, and it leaves us not being very kissable to our significant others or desirable to the children and people around us. I actually had one patient whose wife like banished him to the bedroom. And he said, no, he says, they tell me at the clinic that this means I'm losing weight and you're going to find me sexy. She's like, oh, I don't find you sexy right now. Like, get away. Get away. So we call it the keto breath, which I'm sure many of your keto campers are familiar with. And even if you're not following ketogenic diet, you do get into a state of ketosis while you're fasting. So you're likely to experience keto breath too. Our community has found that, oil pulling with like coconut oil is pretty beneficial, it's great to do regardless of whether or not you have keto breath. I think it's very good for getting all of those tiny little junky bacteria out of your mouth. So we recommend that people do that a few times a week just to help.
Yeah, great explanation there. I would add to this, a lot of individuals who are very toxic, when they start burning fat cells on doing fasting, they'll release that, and it might also cause the bad breath as well. So those are fantastic tips. And then brushing your tongue is another option. Can't see who posted that. It just says Facebook user, but one of the members posted that. Bloating. What about that? What if you're bloated during a fast? What does that mean?
So bloated during a fast, we get some people that feel bloated because they're constipated during their fast. I think it has a lot to do with some adrenal stress. I think that most people have subclinical adrenal dysfunction or undiagnosed Hashimoto's thyroiditis. I've learned over the years that there's two thyroid antibodies, and one could be negative, the other one could be positive. And for some rhyme or reason, like 90% of the labs I look at, doctors will order one or the other, and never consistently like either a specific one. It's really kind of mind blowing. I think everything we've learned over the last decade that we've been talking about for like keto and fasting and for metabolic syndrome, like we're going to go through a huge wave of this like thyroid upheaval. So I think a lot of it has to do with sort of stress on the thyroid, reducing motility in the gut, people becoming constipated as well. Sometimes I think it's also due to electrolyte imbalances too. So making sure that you're getting in plenty of sodium and magnesium. We've never been really big on prescribing potassium except in rare situations amongst our patient population, because they all tend to be quite higher in potassium anyways. So we haven't gone there. We really just focused on sodium as sort of the gateway electrolyte. And if we can try to sustain healthy sodium levels, we will preserve, hopefully, magnesium levels, but we include a lot of magnesium supplementation. And just by doing that, we hope that we are able to sort of sustain potassium as a side effect of that.
Awesome. All right, let's do a couple more here, and then we'll get into some questions. What about if you're getting diarrhea when you're fasting? What does that mean?
Yeah, so a lot of the time, it could be the detox. We do see some bile dumping happening when people do extended fasts. But sometimes too, it's, if your insulin level's high, you jump into a fast, your insulin level is going to drop very rapidly. As your insulin level drops rapidly, it sends a signal to your kidney to release excess water. And so your kidneys can't necessarily handle urinating out or like processing for urination, all of that water. So some of it just goes out through your colon in the form of loose stools and diarrhea. It's not a bad thing. Your body's getting rid of excess water, but you do run the the risk of dehydration. So if you are experiencing loose stools, you might want to stick to shorter fasts for a little while till your insulin levels fall down. Make sure you're really stabilizing your diet on your eating day. You're trying to stay consistent, especially if you're experiencing this issue due to low insulin levels, trying to stabilize your carb intake, reduce it on your eating days to prevent large insulin fluctuations. And then, just hydration, which is not just water, it's water and electrolytes.
Awesome. Great answer. Okay. What about the opposite of diarrhea, which is constipation? Why might that happen when you are fasting?
I think, again, that goes back to sort of a suppressed thyroid function when people are first starting to fast. We see it too. Like we see issues with free T3 levels when people are brand new to fasting. So we see this almost like hypothyroid induced state if the individual already did have some degree of subclinical hypothyroidism or hypothyroidism as it is. And that's usually just sort of an introductory thing as the body figures out that, okay, what are you doing? Like you used to eat like all of the time and now you're not eating at all. And it's sort of this heightened stress alarm state, but stick with it, hang in there. We do see, a lot of, once inflammation is reduced, a lot of improvement in thyroid function in a percentage of the population. I think there's many different etiologies around thyroid dysfunction. A lot of them, I think, have to do with inflammation, cellular inflammation. And once that inflammation is reduced, we see improvements in thyroid symptoms anyways. But at the start, it's a stressful event on the body that's already toxic, like you mentioned, already struggling with inflammation, already having suppressed thyroid function, or having dysfunction. So it's a shock, but just hang in there, be consistent. If it's too stressful, scale back on the fasting a little bit. And then again, with hydration, keep it up, keep the water and the salt up to support the system. That often helps quite a bit. So I would go those routes. I found often too that adding fiber, like in the form of psyllium or chia, actually makes these individuals, the ones who get constipated from fasting, even more constipated. Adding those items in for people who experience loose stools can help bulk up the stools, but for the constipated crowd, it seems to make things 100 times worse. And even personally, I experienced that back in the day. I'm still scared of psyllium from those instances.
Traumatized.
But you could also try taking a magnesium salt, like magnesium citrate, just to help get things moving if you're really uncomfortable as well.
Yeah, and if you have diarrhea, stay away from magnesium citrate.
Yes, yeah. Switch to threonate, biglycinate, malate, a different type of magnesium salt that's perhaps more well absorbed.
What about this one I saw that I get asked all the time? I made a video about it, but why would we get cold during a fast?
So there's a couple of different reasons. I think that the thyroid might be one of them as well. So that initial sort of thyroid stress. Another one that we commonly see is we see it associated with very low ketone levels. So people that are struggling to access their fat stores and burn fat efficiently. And we usually see that the warmth improves sort of in correlation with higher ketone levels. So in terms of having to become better at liberating one's fat stores. I don't know what you've seen, Ben.
Yeah, I know that when you're fasting, you're activating some more of the brown fat, the brown adipose tissue, which could also take blood flow away from the muscles, and it moves blood flow around, which could result in that. But that was interesting what you shared about those who are having issues getting good amount of ketones. I'm going to pay attention to that and see if I could correlate that as well. I saw a study in mice that showed mice with low levels of orexin, which is a brain neurotransmitter. They were shivering more often, and so some people have lower levels of orexin. So caffeine could actually help that and make it a little bit higher. So caffeine could help, moving around could help, getting those ketones up could help. But it's so common. I don't know if you see it, but I see a lot of people ask me about being cold during a fast.
It's really common, and I have only a handful of people that once we don't get them into a sort of a fat adapted state. Usually, almost always, I see it reverse in a fat adapted state. But there's a handful of individuals that just don't quite shake it. ever, it seems like. And a lot of these individuals, one who I can think of, just coming to mind, I was talking to him earlier today. I mean, he's hit his health goals. He's 17% body fat for a 70-year-old. He's been off of his diabetic medications for years, on 0 medications, wonderful health, great inflammatory markers, doing really well. So it's really interesting. I didn't know about that. So I'm going to tell him to maybe enjoy his coffee.
Yeah, it could help. It could, or even tea with caffeine. Yeah, so I'm curious to let me know if that works for him.
Well,
okay, we have about 10 minutes left or so. I want to get to the questions here from the Keto Kamp Academy members. So I'm going to scroll up and do it first post, first serve. We have Amanda over there in the UK says, what does Megan think of the use of metformin for women with PCOS, even if I'm on a keto diet and not a type 2 diabetic? Can it still help?
So, I mean, metformin in general, I think, is a pretty benign medication. I do know a lot of people out there, like we have 22-year-olds begging us for prescriptions for it because for longevity reasons.
Right.
I'm not necessarily completely taken by the science on it personally, but I don't think there's harm in taking it. In terms of PCOS, I don't necessarily think it's necessary. I've seen personally incredible improvements, reversals of PCOS just through nutrition and fasting without the addition of a medication. So I don't think it's harmful. The long-term data on it, I haven't found to be discouraging. Patients who choose to stay on it, I'm in support of, or if they, are really sort of PCOS, very concerned about fertility, I can relate to that because I'm trying to plan for a family one day post-pandemic era. So I understand wanting to get your body into good shape. So I don't necessarily think it's harmful, but I don't think it's necessary. We've seen incredible improvements with fasting, with keto, but fasting and doing keto, and carb cycling appropriately to support female hormones.
Yeah, that's a great segue because somebody asked, when should we start keto flexing? So that's my terminology for carb cycling. When do you think that's appropriate for somebody?
We were talking about this too in our community yesterday. I mean, I think it depends too on the health goals and why an individual's there to see you. So if someone is extremely diabetic, like an insulin dependent diabetic, is still navigating a sea of issues like food addiction issues, emotional issues when it comes around food, we try to stay pretty ketogenic with them at the start, just because even a little bit having that food around in their home, it ends up being counterproductive. So any benefits they would get from cycling in some carbohydrates on the weekend ends up going out the window, and it's just not good. So usually we introduce it to people, especially women, when they're, I think, like the halfway mark throughout their journey. So at this point, they're off the majority of their diabetic medications. They're seeing much more improved glucose control, really huge reduction in inflammatory markers and symptoms alleviated across the board, a much better relationship with food and body image. They've developed some other great stress management techniques rather than food comfort. And at this point, they're not necessarily looking at these like food items, like I'm talking like real foods, like sweet potatoes, for example, for carb cycling. And they no longer look at it and see fear. They look at it and say, okay, that is a real food. And if consumed properly, it's probably not going to be that counterproductive. And we find that most people sort of hit this midway through their journey. And that carb cycling, I find, really helps support female hormones. It helps support adrenal function. It helps support thyroid function. We see people midway through a journey too, if a woman has been doing straight keto and has been fasting quite a lot, we do sort of see them hit this plateau where it's difficult for them to access body fat despite changing up the fasting and everything else. And introducing carb cycling provides them, I think, with enough of that hormonal support just to help them. And it's crazy because within a couple of weeks, they're suddenly dropping a few pounds and they're feeling good and sleep is better. So it's usually around that halfway mark. I find that it's just logistically, it complicates things at the start because there are so many issues. And then, okay, we just really want to get this person off insulin. So it's just weighing the pros and the cons of the situation at the time.
Yeah, great answer. That's a similar approach to what I teach in the academy. I have 4 pillars. The last pillar is the keto flexing. And if somebody reaches that pillar, which is typically about after 3 months of starting their journey, if they've reached a pillar but they still have insulin resistance or type 2 diabetic, then you could get an effect by just having a high protein day and just getting more mTOR on that day, right? So that could be something that you do. I know David, who's on here watching, type 1 diabetic, I have him do that because he's type 1 as opposed to increasing his carbs too much.
Yeah.
Okay, we have a question here from Kira, who just joined the academy earlier today. She's also in Canada. She says, "Hi, Megan. I have started to experience right elbow joint pain after fasting and starting a keto diet. Could you suggest some remedies or possibly clarify what might not be working for me?"
So this isn't uncommon to sort of experience some joint discomfort when people are new to fasting, and there's a few different reasons why this might be. So of course there's general like detoxing that can be happening. There's electrolyte deficiencies that could be happening. We also see increases in uric acid levels when people are brand new to fasting. So fasting can, when someone just starts fasting, it can sometimes trigger gout attacks by increasing uric acid levels. And we see this because the body becomes a bit dehydrated because we see that insulin drop and we lose salts. So it could probably be related to uric acid levels, I would suspect. So one thing just in general to cover your bases is getting in more salt with water. Uric acid levels too, we sometimes add in a little bit of lime juice if we suspect that's an issue. Lime's a great solvent for uric acid, so that might help. If there's an electrolyte issue, adding in salt can't go wrong, can help with that as well.
Yeah, great answer. I love that. So we have 5 minutes left. Do you have an extra 5 minutes or do you have something ready? Okay.
No, I'm good.
I want to get to a few more questions here. We have another.
I have exactly 5 minutes. Sorry.
Oh, you have exactly 5 minutes. Okay, got it. So we'll do one more question here. This one says Facebook user, but I have their name here. I want to make sure I acknowledge them by name. If I could find it here. Let's see. Okay, here it is. Michelle. For someone with difficulty to build muscle and maintain muscle, is fasting doable? I will take your answer to my doctor for discussion before attempting to implement. Awesome. So what do you think?
Yeah, fasting is definitely doable. I would want to investigate further, why you're having issue building and maintaining muscle. If you don't already know, investigate that with your doctor further. I mean, perhaps you need some thyroid support there just to help, or looking into other areas of why that might be a potential issue. But with fasting, we get all these counter-regulatory hormones I've talked about. And one of them is human growth hormone, which we haven't mentioned. And so human growth hormone is great. I mean, it helps us, grow and be strong. And when we're young, we produce a lot of it, but as we age, we don't really produce any of it. So that's difficult. So, we want to be nice and strong as we get older, but we don't want to grow too much or experience too much growth, because that's very counterproductive for longevity and puts us at risk for all kinds of other unwanted health conditions.
Right.
But when you do these intermittent periods of fasting and getting these, periodic shots of human growth hormone, it's great. So what happens is you fast and then you enter the feeding cycle again. And you get amino acids from the protein that I assume that you're eating at that meal. You'll get some insulin secretion as a result in the presence of human growth hormone. And those 3 items are sort of create the perfect storm for you to gain lean mass. So we see, I've had patients that are double amputees, wheelchair bound, and they gain lean mass fasting. When we do composition analysis on them, because of the counter-regulatory hormones, because of human growth hormone production and that fasting feeding cycle. So it's been really wonderful. We've seen improvements in elderly women in terms of their osteoporosis, which has been amazing. Lots of improvements in lean mass gain. So fasting may actually help and be productive for helping you maintain and gain some lean mass.
There you go. Megan, where's the best place for the keto campers to go check out your work?
Yeah, so you can come check us out on thefastingmethod.com. Geez, I'm losing my mind. On August 17th, we're launching a completely new website and a completely new program. So it will be much cooler looking on the 17th. So if you're interested in learning more, checking out our blogs, we have tons of free blogs and information up on the website. But if you want to see it in a cooler format, put the 17th of August in your calendar.
We'll put that link down below. Also a link for your latest book down below. Megan, you're a wealth of information. Thank you so much for your brilliance and your expertise. I'm grateful to know you, and I'm grateful for this conversation. So thank you for coming back to the show.
Awesome, Ben. Thank you so much. I'm so grateful for you too.